In this video, let us compare awake spine surgery versus traditional spine surgery under general anesthesia, patient experiences, risks, recovery, and also the doctor experience. Awake spine surgery, we usually use regional analgesia or anesthesia. We only numb the part where we are doing the surgery. You are completely awake, you are breathing on your own and able to appreciate the surroundings also. But yes, in traditional spine surgery using general anesthesia, you will be put on a tube and given general anesthesia drugs and put onto a ventilator machine. Awake spine surgery usually avoids the risks associated with general anesthesia, especially in the elderly, that is beyond 60 years, and patients having complaints regarding diabetes, hypertension and other medical disorders, which is making general anesthesia complicated. We will be avoiding the drugs used for general anesthesia and also avoiding putting a tube through your mouth and putting onto the ventilator machine. Let's talk about the patient experience. You will be numb in the area where the surgery is being performed. You will be breathing on your own, able to appreciate the surroundings. You will be given mild sedatives so that you can sleep during the entire procedure. But the area where the surgery is being performed, you feel no pain. However, in general anesthesia, the patient is completely knocked off. He is totally onto the ventilator machine. He doesn't know what is happening around him. After the surgery is performed, he usually comes out of general anesthesia. But few patients might experience confusion, nausea, vomiting like feelings after the anesthesia. However, few patients who feel anxious about what is happening around me, what are they performing on me, probably these patients are not suitable for awake spine surgery. No matter what surgery you are performing, the question is always about recovery. So in awake spine surgery, the recovery is on the very same day. You can come walking down the operation theatre table on the very same day after the procedure under awake spine surgery. The patient can be discharged home on the very same day without any complication. However, patients undergoing traditional spine surgery under general anesthesia might be asked to stay back 1 or 2 nights in the hospital after the general anesthesia. The risks and complications of awake spine surgery and general anesthesia. During general anesthesia, especially in the elderly beyond 60 years with some mild cardiac risks or moderate or severe cardiac risks, yes, there might be few complications, especially when coming out of the general anesthesia. The patient might be confused, patient might have throat irritation, few people, especially the elderly, might lose some teeth. Very rarely, the patient might have to be on the ventilator machine for some more time. Yes, awake spine surgery avoids all these kinds of complications and you are always awake during the procedure, and if you feel uncomfortable, you can definitely communicate back to the surgeon. Not everyone likes to be awake during the entire procedure. You can be sedated during the entire procedure in awake spine surgery. But yes, if you are still anxious, you can definitely undergo traditional spine surgery under general anesthesia. Now, let's understand who are the ideal candidates for awake spine surgery, especially the elderly who have been given high risk for any of the reasons, for the medical reasons, the cardiac reasons or any diabetic reasons. They might be suitable for awake spine surgery, and any surgery can be done under awake spine surgery, especially the lower lumbar spine surgeries can be done in awake spine surgery. Awake spine surgery can be an ideal spine surgery procedure under epidural analgesia when you are operating for 1 or 2 levels of disc prolapse or decompression surgeries or fusion procedures. But yes, major procedures like deformity corrections or cervical spine surgeries usually require traditional general anesthesia. Bottom line, awake spine surgery and traditional general anesthesia for spine surgery are two different things. In awake spine surgery, you are awake, experiencing the surgery during the entire procedure, but you are numb, not feeling any pain. But in general anesthesia, you will be put through a ventilator machine with a tube in your mouth. In my experience as a spine surgeon over the past few years, generally elderly people who have been given a high cardiac risk or a high risk for surgeries under general anesthesia do much better under awake spine surgery and be discharged on the very same day.